Good morning. My name is Jennifer Levine, and I am a physician assistant and your urology coach. I wanted to talk today about the role of a Foley catheter that is placed in the bladder after prostate cancer surgery. It's important to remember that when you have your prostate gland removed, the surgeon needs to reconnect your bladder with your prostatic urethra, which means the urethra is the long tube that is throughout the length of the penis, and the surgeon needs to delicately sew the bladder back to this urethra. Now you can imagine that fresh sutures after a prostatectomy, those sutures need to heal, and the bladder, if it gets really full, it's likely that those sutures are going to pop. So a Foley catheter is placed in the bladder to constantly drain your urine so that the bladder does not get full and distended, because if it does get full and distended, there is a chance that those sutures or that anastomosis, that reconnection, might get damaged. So a Foley catheter is something that many people fear after surgery, which is to be expected because the thought of having a tube in the penis can be somewhat ominous. But I am here to tell you that usually a Foley catheter is not that bad after surgery. I personally have never experienced it, but I know from patients after talking to them when taking out their catheter, they always say that the anticipation of having that tube in the bladder is worse than actually having it. Now, everybody's situation is different, but a Foley catheter is definitely necessary after prostate cancer surgery. Usually before you're discharged home from the hospital, there are nurses that can definitely teach you how to care for your Foley catheter at home so that there is less, scariness at home with a Foley catheter. So a Foley catheter usually stays in the bladder for about 7 to 10 days to allow that connection to heal, and then you go to your surgeon's office and it is taken out. I always tell patients that it's put in while they're usually asleep under general anesthesia right before prostate cancer surgery, and it always hurts more going in than coming out. And the good news is you're usually asleep when it's put in, but coming out really is not that big of a deal. Most people are so relieved once their Foley catheter is removed. Please go to www.jennmed.com for any kind of information that you might need. Prostate cancer is my first product launch. I have an ebook on that website, and it's called Living Fully After Prostate Cancer Surgery. And I believe that if a man has prostate cancer surgery and reads this book, it's a 26-page easy read that it can drastically change your post-operative course. I'm Jennifer Levine, and I'm here for you if you need my help at all. Have a wonderful day and take care. Bye-bye.